This is Dr. Ilana Ackerman from the School of Public Health and Preventive Medicine at Monash University in Melbourne, Australia. I'm pleased to be talking to you about my JBJS article, Lifetime Risk of Revision Hip Replacement Surgery in Australia Remains Low. We wanted to do this research to better understand changes in the use of revision hip replacement surgery at a national level. We also wanted to quantify the likelihood of someone having revision hip replacement surgery in their lifetime. So we used a lifetime risk approach. Lifetime risk analysis is something that's fairly novel in orthopaedic research, but it's been used fairly commonly in the cancer field. It's a useful approach because not only does it include the number of surgeries performed, it also considers the population size and structure and all-cause mortality rates. It enables us to do a couple of things. Firstly, we can use the estimates for ongoing population level surveillance, for example, to detect an unexpected increase in adverse outcomes. And secondly, we can also use the estimates for international benchmarking. Arthroplasty registries around the world use slightly different ways of defining and reporting revision burden. So lifetime risk analysis offers a standardised approach for comparing revision burden between countries and looking at changes over time. We know from previous research that the lifetime risk of primary hip replacement surgery has increased over time in many countries, including Australia. So it was pleasing to see that not only has the lifetime risk of revision hip replacement remained low, it's actually decreased slightly over time for both males and females. We also saw that the lifetime risk of revision surgery remained well below the lifetime risk of primary hip replacement, which is a positive finding. And this probably relates to things such as the close monitoring of patient outcomes after primary hip replacement, the focus on using well-performing prostheses, and also providing surgeon feedback on surgical outcomes. So, what we don't know, of course, is where these estimates sit in an international context. So the next step for us will be to undertake an international comparison of the lifetime risk of revision hip replacement in other countries. And this is something that we look forward to undertaking in the months ahead. Thank you for watching this video, and we hope that you enjoy reading our research.